Hello, everyone. So I'm really excited to introduce you guys to Jenn Taylor. She is a licensed massage therapist and a NCTMB approved provider for continuing education. So she offers courses with us. She's also a life coach and an energy worker, and she's an ICF certified life coach for entrepreneurs. So, as a massage therapist, if you're an entrepreneur out there, she has a lot of resources for you as well. But specifically, we're going to go into talking about prenatal massage, postpartum massage, and the infant massage classes that she has coming up. She began her massage career in 2006, and she became a continuing education provider in 2014. So she's always enjoyed teaching, and she has a desire to share the current information with her therapist. So this particular therapist, Jenn, I actually met before I became a massage therapist when I was working for one of the chiropractors here locally. So again, I'm always excited to introduce you guys to some of the therapists that we're working with and what their passions are. And so we're going to ask some questions for Jenn today. Hi, Jenn.
Hey, Kara.
So I know that one of the things that we think about when we think about massage is therapeutic benefits versus pampering. Some people think massage is just for pampering. So as massage therapists, we're always educating people. So when we talk about prenatal and postpartum massage, which is what you do and teach, can you tell us about what the benefits and the gift of that for clients and for the practitioners who are out there who might be wanting to learn this? Because we know that some people might gift a prenatal massage for someone as like a pampering thing. But we'd love to hear more about your experience working with clients and also how it can benefit other massage therapists out there.
Yeah, absolutely. So I would say the biggest gift for prenatal, postpartum, and infant massage is stress reduction and calming the nervous system, like hands down. Like, of course, we're going to be addressing, tight muscles, postural changes in the pregnant body and helping with new positions in the postpartum body and getting back to the postpartum pre-pregnancy body. But stress reduction is the biggest gift for your clients. And so many people don't realize the effects that stress have, not only on the mom, but it transfers right to the baby. There's a lot of research, there's a lot of studies that have been done that show that higher stress levels in pregnant moms directly correlate to stress levels in babies and even into teen and adult years. So that is my main focus on educating my prenatal and postpartum clients. And infant massage, the benefits, bonding with your baby. So not only in my class do I teach a therapist how to do the infant massage, but I teach the second part of the class is teaching the therapist how to teach parents and caregivers how to implement these techniques with little ones so they can reap the benefits with the bonding, listening to their cues. Babies can tell us incredible amounts of information if they want to be massaged, if they don't want to be massaged. We call it requesting permission. And it helps babies understand they have permission to decline or accept touch, healthy touch. So that's just going to go with them throughout life. So many benefits. Of course, there's going to be, relieving the tight muscles with pregnant women. There's so many joints that are affected, cervical area, thoracic, especially lumbar. And I think it gives it's just so much joy when you can effectively help your prenatal and postpartum clients in the sessions and not only work with them with all the different structural changes, but with the reduction of the massage and different things that you can incorporate. It just is a gift for everyone all around. For me personally, when I transitioned into specializing in prenatal, it's easier on my body too, because I do a side technique. So that kind of made my career a little bit longer. I've been a therapist since 2006. So that was a huge gift to me. But it's just so much, it's a great energetic exchange. The client's receiving and the therapist is receiving. So it's all really beautiful.
I think it's also that gift of also being there as the baby's developing. And I think that's fantastic. I actually think that if I had pregnancy massage during the time when I was pregnant, it would have been such more of a gift to me. Because I know if you get the common sciatic pain that women get, you can't really take drugs for it. And I think that most people don't always know that prenatal massage can be supportive.
Mhm.
I sleep with a pregnancy pillow every night, but you know
Okay.
how when your ligaments get more flexible when you're pregnant,
Yes.
I actually just have flexibility in my joints all the time. So I'm always in pregnancy pillow mode sleeping. And I
Oh,
think that really supports like a lot of the structure for me. But if you're impacted as a pregnant woman, it's definitely beneficial. So I'm curious, are there any myths or misconceptions that you commonly have to educate clients or massage therapist students about prenatal, postpartum, or infant massage?
yeah, there's not too many myths around postpartum. It's more of people don't really value that women can come in for postpartum, and there's so many different things that can be addressed to help them get to that pre-pregnancy state. Again, stress reduction, but helping everything with the postural changes. But prenatal
Hmm.
has so many myths, so many myths that we address in the class because I really don't feel like there's a ton of information in massage school. Like when I went back in 2006, we spent a half a day on prenatal massage. So I
Yeah.
was very ill equipped to come into the real world and start practicing with pregnant clients. That's why these classes were birthed way back then. So I could learn for myself and then teach other therapists so they could feel really, really confident and really safe, knowing that what they were going to be doing with their clients is going to be okay and not harmful. But there's so many myths. I've heard every myth you could imagine. Some people have been taught, don't touch the belly on a pregnant lady. There's a lot of myths around the legs. You do have to take special considerations because they're more likely to develop blood clots because they have like an anticoagulant, thing going on, so they don't hemorrhage during birth. There's a lot of myths around acupressure points. First trimester is always a really big discussion that we get into for different liability reasons and things like that. So yeah, we go into lots of myths, look at the research, the facts, and help therapists make a really good decision moving forward with their clients. Infant massage, not too many myths because not many people even are aware that they can work with their little ones in that way. So a lot of it's new information to many therapists and to many parents and clients as well.
Now, as far as the infant massage class, is that open to lay people or just massage therapists?
Mhm. So I teach two different classes. So the ones, like at your at Firefly, they're going to just be to the therapist because it's a pretty in-depth training. And then I offer like a 2-hour class to the public where, or sometimes a series, like a weekly 5-week series where parents come in with their babies. We meet an hour a week and they get to know each other and go through each little protocol. And that's learn in the therapist's infant massage class too, how to market that class and how to organize it and teach it and all the things. So yeah, it's geared towards both, two different ones.
That's great. That's great. Well, are there any special consideration that maybe one needs to take if they're looking to book or find a therapist that is specifically trained for prenatal, postpartum, or infant? Like, what should someone look for when they're trying to find that service for themselves?
Yeah, they should definitely ask if they've had adequate training and not just a few hours in massage school, right? Because there can be real consequences if somebody does not know contraindications, precautions. There's a lot around like using different essential oils, different unsafe positioning where the baby's oxygen might be cut off, all kinds of different things. So definitely make sure they're adequately trained. Um, and with any massage therapist, like make sure the client feels comfortable with that person and safe with them. And also, something that I really want therapists to know in the class, if they don't feel competent and confident, their client's not going to feel safe with them. The client will feel that exchange of energy, right? So you have to be confident. You have to know your stuff, right? When you're working with
Yeah.
pregnant ladies, postpartum, like there's still a risk of blood clots for a while, right? They could have had a vaginal delivery, C-section, it could be breastfeeding. There's lots of considerations to make sure they're comfortable and feel really, really safe.
Yeah. I love doing these interviews, not only for the regular clients who don't know about prenatal because, or even any type of massage, but also for the instructor, for you to share with the students, because I think that most people, again, we are always doing constant education to clientele that massage isn't just for pampering. There's so many different types of massage and uses therapeutically, and this being one of them. So this information is very, very helpful for those who maybe are considering getting pregnant or are pregnant, or even have a little one that they want to learn, or have a therapist who is trained in infant massage. I think it's just a blessing, all the things that you're offering. But I'm curious, as far if I'm a massage therapist and I'm interested in taking your classes, could you tell us a little bit more about your teaching style? What
Mhm.
skills will they learn taking classes from you?
Yeah. So my teaching style is very relaxed, very casual, because I really want to make sure my students feel safe. I hold a lot of very, very safe space for them, make them feel very valued, because everything that they know is also a blessing to me. Um, I want it to be an inclusive, very, very safe environment. Really encourage students to ask questions. There's no dumb question. All of my classes, I do a PowerPoint, and I give a packet so they can have the whole entire PowerPoint. Most of them are like 80 slides. So I load students up with more information than they will ever need. But I always err on the side of caution and give them so much information. But it's not overwhelming at the same time, because it's all very, very interesting. I always have people in my class that are passionate about the subject. I don't really get people that just take it just to get credits, right? They're on the path that I was. Like, they're passionate about helping pregnant women, and then helping them, prenatal, postpartum. And then they can add in the infant massage where they teach the parents. And it's just such a beautiful process to be part of, with your client. So I also offer hands-on time to make sure they're really comfortable with positioning, with draping, because draping sideline can get really, really tricky sometimes. So everything has a hands-on element, and generally, it's just all about making sure the therapists feel very confident when they leave.
That's amazing. I think the thing that you talked about with trying to select a massage therapist with the right training, is there any specific extra trainings, like what is the labor stimulation massage? Is that something that you have resources for, and other types of trainings that people can access through you too, if they want to even go further, or the trainings that you don't have resources for? Because I know that there's even more out there for this
Mhm.
topic.
Yeah, specifically, well, that no too many, honestly, of like the labor stimulation. That is more doula based from what I've seen in the industry. But I do have lots of resources on different techniques for pre. It just depends on how advanced somebody wants to get. My 2-day class does cover a ton of information, 16 credits of prenatal and postpartum. But everything, with like labor, and even like I'm a postpartum doula as well. There's so many resources for doulas if they want to get in there and start working, because you're doing a lot of massage as a doula too sometimes. It's
Mhm.
great when a massage therapist becomes a doula, and they can go into the birth as well.
Yeah. Yeah, our one of our massage therapists will be taking your classes, because we require everyone who does any if you ever book a massage at Firefly and you have a prenatal session, they have to have been trained, not just the
Well,
2 hours in school. They have to have
yeah.
gone through a training with yourself or something extensive. So I know one of our therapists, she's really excited for focusing on pediatrics and the infant massage. So she does prenatal already, but she's really excited to extend that. And I think that's needed, not just with babies, but also, younger children and teenagers, for the stress that they go through and all that.
Yeah.
So, but I would say anyone out there that's watching this, there's not a massage therapist. This is the best industry, I think. It's so rewarding, and there is a shortage of massage therapists, so we need more. There's an increase in the demand. And so if this is curious to you, not only just to maybe get a prenatal session for yourself, or come and learn infant massage for your own child, or to get trained, I always encourage people to learn more about massage therapy as a career path, or even like a side career, because there's just so much more to it than just what you think. So Yeah. Well, is there anything else you want to share with us before we go today, Jenn?
Um, just to kind of sum up what you said, like educating and not just seeing massage as pampering, right? Because if you're somebody who just comes in like once a year or twice a year for a birthday or an anniversary, that's amazing. And there's so many therapeutic benefits to massage, all types of massage. And if you come on a regular basis, like it really is part of your healthcare program. And especially the rapid amount of change that your body endures in pregnancy and postpartum period, it is ever changing. I have clients that would come in every single week of their pregnancy, and their body and their posture was different every single week. So it's very,
Wow.
very supportive.
Wonderful. Well, if you guys are interested in signing up for any of the massage classes with Jenn, we have them throughout the cycles. And then they will be on our website. And if you have any other further questions at all, ever, you can always email us. But we look forward to having you back for teaching. So we will see you guys soon. So thank you guys for listening and joining us.